as always. And as you can see, I'm back to my bar stool. The chair was nice, but it's for me to sit on the bar stool. I'm a little more elevated, right? So it helps me to be able to move around and maneuver the board a little bit better. It was worth a shot. But hey, maybe the computer chair will come back, who knows. This video, I want to go ahead and talk about weight loss drugs, all right? So I wanted to go ahead and sort of break this down a little bit, because it kind of got to my attention that, weight loss drugs, I was surprised at the amount of people who simply looked at weight loss drugs as if it was a simple fix, right? Like it was just an easy, fix or whatever to their issues that they were having with losing weight. But, I kind of want to go into why it's not an easy fix, but also talk about what makes them effective, because they can be. So I want to start first of all with going over what the FDA considers, right? Like they consider the following factors when it comes to weight loss drugs before they get approved, for prescription and for use. These are the 4 factors, right? There's usually 4 that they go over. The first one is risk versus benefit. Okay, so what that basically means is, is this drug going to be, what are the risks versus benefits? You know what I'm saying? So like, is there more risk than a benefit, or vice versa? Is there more of a benefit than a risk? That's something that does have to be taken into account before, a drug can be approved. If the risks are greater, then it's going to, of course, affect the approval process. It'll most likely, get shelved, because they don't want to, or at least I should say, the goal is to ensure that you're not giving people something that is of higher risk, than there is benefit. So that's one of the first things that they evaluate. Second thing being, is there a potential for abuse? Okay, so as many of you know, when it comes to drugs of just about any kind, there is a potential for abuse, right? There's a potential for psychological and physical dependence and reliance upon said drug. The next thing they want to go over is weight loss potential. Okay, so will the drug that they're looking at trying to put on the market what is the potential for weight loss? Is it high? Is it low? And if it's low, what can we do to perhaps make the potential grow? Or, is it something that we should just shelf altogether? That's kind of how, the FDA does things. Since it is a weight loss drug, obviously, you want a weight loss drug to be able to do what it's supposed to. You want it to do what's in the name. And the last one being the potential to reduce comorbidities. So what that basically means is, for the weight loss drug that they're looking at trying to approve, does it also have the ability to, reduce comorbidities that come with, weight gain, right? Because as many of you know, as I've talked about in my previous videos, obesity, right? Having more fat on you and more weight can also increase comorbidities, that being like hypertension, high cholesterol, diabetes, strokes, things like that. So those are comorbidities, right? Comorbidities essentially are like conditions that come with obesity, or that come with a specific type of condition you're dealing with. So when it comes to weight loss drugs, obesity is really what's being centered. That's the crux of the issue. So obesity, comorbidities being, something that obesity sort of brings on. So of course the weight loss drug, they evaluate the potential for comorbidities to also be reduced in addition to the weight. There are about 4 criteria that, essentially doctors will look at before they prescribe you a weight loss drug, right? So first thing they look at, of course, is your BMI, right? And of course, in certain situations, BMI may not always be the, deciding factor. It may not always be like a great factor to look at when it comes to weight, because there are people who, like myself and others who are even bigger than me, right, have a lot of muscle or what have you. BMI doesn't necessarily take into account body fat, right? So, I tend to, when I go to the doctor each year, I tend to have a higher BMI, usually not over 30, but it's like in the higher 20s, right? Which is essentially considered overweight. So I'm always, even when I was in the military too, in the Army, I was always considered overweight, right? I was always able to pass my PT tests, but when it got to the height and weight portion, whenever I would step on the scale and I would weigh a little more than I'm supposed to for my height, I had to get taped, right? I did, old school, you get the tape measure your waist, neck, all of that, and then get your body fat percentage. So BMI, it's It's an indicator. I'm not gonna say it's a bad one, but I'm also not gonna say it's a good one, because our body types are all different, right? So BMI over 30 though, that is considered obese. So that's one criteria that they look at, doctors will look at for a prescription of weight loss drugs. Or if you have a BMI of about 27 with at least one health risk factor. The second thing is if you are unable to lose weight by diet and physical activity alone. So if you've tried that, if you've tried everything you possibly could and it's still not, helping you out at all, then of course they'll look into that as well. There may be reasons as to why it is that you're not really losing the weight that you're supposed to by diet and physical activity alone, but typically that's where your doctors come into play. They can essentially go over why it is that's happening for you. Sometimes it's genetic, which actually, believe it or not, skipping all the way down to the last thing, genetic history. Sometimes genetic history can be an indicator of how obese you may get. So if you have obese parents, right, if it runs in your family, there's a possibility, I should say, that you can also be obese, especially if, in the early stages, things aren't, curbed. Like, the amount that you eat, right, your portion sizes, what it is that you're putting into your body, getting yourself active, right, as kids, stuff like that. If it's not stopped early, then you can very well follow your parents. Environmental factors can oftentimes, outweigh genetic history, but even still, genetic history is still a factor, all right, that they take into account. And then the one that I skipped was if you have existing comorbidities or the need for surgery in order to see immediate weight loss. Here are the different types of drugs. So you have what's called anorectic or anorexiant type drugs. An example of that would be amphetamines, okay? And what these basically are is these are drugs that will suppress your appetite, okay? They suppress and inhibit your appetite. Now these other ones, they do also, but in different ways. Catecholaminergic, okay? So catecholaminergic drugs are basically drugs that will increase levels of norepinephrine and dopamine in your system in order to inhibit and suppress your appetite. So the reason why that's important is because if you don't know what those do, norepinephrine and dopamine, those are both neurotransmitters as well as hormones in your body. Most of y'all know what dopamine is. You've probably heard it before. Dopamine is our body's reward system. So when we're doing something that's pleasurable to us, maybe it's playing a video game, maybe it's hitting the gym, working out, maybe, it's whatever your hobby is. Maybe it's like woodworking, maybe it's hiking, right? Rock climbing. Our body releases dopamine. It's like, that's our happy moment, right? And so norepinephrine, it's the hormone / neurotransmitter that helps stimulate your body's fight or flight system. Catecholaminergic drugs increase your norepinephrine and dopamine levels as a result of trying to get your body to inhibit your appetite so that you eat less. Serotonergic drugs. So if you look at the prefix, you see serotonin, right? Maybe you've heard of the hormone / neurotransmitter known as serotonin. That's what we use for appetite, of course, and digestion, right? Serotonin plays a part in that. It also plays a part in our ability to learning, so cognition, right? Basically, our central nervous system, that's where, serotonin comes in. Well, phentermine is a type of drug. It's the drug that's most commonly prescribed, right? Studies have shown that between 2008 to 2011, 6.2 million patients or individuals were prescribed phentermine, okay? And phentermine is also known as a Schedule 4 drug. Now, the reason why that's important is because it's a drug that's meant for short-term use, right? About 12 weeks. Reason being is because phentermine has been shown to have right up here, it has a low potential for abuse, okay? However, if phentermine is abused, it could cause physical and psychological dependence. No more than 12 weeks usually is the course for that type of drug. What I'm gonna go over, this is a table that I grabbed out of my learning material for the weight loss drugs and their effects. The intended effect for most of these drugs is appetite suppression up until you get to the orlistat. Orlistat is to inhibit fat absorption. But then phentermine, okay, if you look, the next column over is average weight loss expected. So you'll kind of notice a little bit of a trend here. In the first column of drugs that are approved for long-term use, the initial weight is a little higher. Okay, the percentage of initial weight loss is a little higher than that of the drugs that are approved for short-term use. So like with the first four, okay, lorcaserin, phentermine / topiramate, and naltrexone, and as well as orlistat, all of those have, a little bit higher weight loss expected. Okay, so like the first one, lorcaserin, 5 to 10% of your initial weight, equaling about 7 pounds. The second one, phentermine / topiramate, you're looking at 10% of initial weight loss, equaling about 15 to 22 pounds. Then you have 6 to 7% of initial weight with the naltrexone, and then you also have orlistat, which is you're looking at about an 18-pound weight loss, or equal to about 11%. Also, if you want to take a look, there's the adverse effects. I won't go over all of them because there's effects that I have over here on the other side of the board that I want to kind of go into more detail about, right? These are basically the adverse effects you may see when a medicine is being promoted on, like YouTube or any type of commercial advertisement, right? You may see these side effects. But these side effects will be a little bit more broken down as to why it leads to these adverse effects here. Very bottom part of this table. The drug approved by the FDA for short-term use, that's the phentermine. Because of the type of drug this is, it's approved for short-term use. This is specifically the phentermine that is a Schedule 4 drug. So it's approved for about 12 weeks. You get 4 to 6% of your initial weight loss. So you notice the percentage is a little lower. And I'll talk about that also, towards the end. Headache, insomnia, dizziness, anxiety, irritability, and then some possible cardiovascular effects. As we all know, right, any drug that gets advertised, there's side effects with all of it. It's vital that when you're considering any type of drug, be it weight loss or whatever, any type of drug, you really got to go over that with your doctor. Metformin, and actually I have a family member that takes metformin. She also takes Jardiance as well. Most of these is for, as you can see here, metformin is to help normalize glucose metabolism in type 2 diabetes. So this family member, she does deal with type 2 diabetes. She takes metformin and I believe Jardiance and Trulicity. There's a lot of medications that she takes that she's trying to get herself off of. Luckily, type 2 diabetes is the type that can be reversed in a sense. That's the type that you can do something about. It's when you have type 1, you got to take insulin externally, usually by way of injection or what have you, or by pump. There's not much you can do about that. Once you're on type 1 diabetes, that's kind of it usually, right? It makes up a rare percentage of cases, but once you're on it, that's a wrap. Type 2 is the most common type of diabetes. So about 2% of initial weight loss is the expectation for how much weight you'll lose. Next thing is pramlintide, which is meant to reduce caloric intake. And then you have GLP-1, right? So that's to also help reduce caloric intake in type 2 diabetes. So again, it's to help, essentially in the grand scheme of things, anything diabetes related, you take drugs for diabetes. In the grand scheme of things, it's to help your pancreas and the beta cells that come from the pancreas help be able to secrete insulin better and to help get a better control over the insulin so that it's not spiking, right? And you're not dealing with high numbers as a result, because that's what happens. Now there are it says minimal, but to follow, there have been some recent concerns about pancreatitis and pancreatic cancer with GLP-1 medications. There's some drugs that are no longer approved by the FDA. Amphetamines is probably one of the more common types of drugs that have a high potential for addiction. Okay, you're looking at maybe methamphetamines, which is in your form of crystal meth and stuff like that. So you do want to be mindful, right? And then there's also certain amphetamines that come in pain meds. So they have a high potential for abuse. Another type of amphetamine is Adderall, right? Adderall is typically used for those who have ADHD, right? People who have that hyper version of being unable to concentrate. Next thing is phenfluramine, right? And other, you got dexamphetamin and all of those combined with phentermine. Ever since 1997, those drugs have not been approved by the FDA. It's always important to go over the side effects, which actually is gonna take me to the second side of the board. just to clarify, these side effects usually happen from abuse cases. High levels of serotonin can give you what's called serotonin syndrome, and that's a very life-threatening syndrome. Some of the symptoms come as insomnia or in the form of confusion, rapid heart rate, and muscle coordination loss too. There are some others, but these are some of the top experienced when it comes to high levels of serotonin, leading you to serotonin syndrome. Elevated norepinephrine, our body's ability to stimulate that fight or flight response. Essentially, when you have a hormone that's in a constant fight or flight response, you can imagine you're looking at hypertension, of course, rapid heart rate, and excessive sweating. Fight or flight is not supposed to last you that long. So when you're in a prolonged state, elevated levels of norepinephrine, being in a prolonged state of fight or flight, can easily lead you to these. And last but not least, you could be looking at elevated levels of dopamine, right? As a result of the drug that, helps elevate dopamine, which is the catecholaminergic. So you could be looking at aggression, addiction, hallucination, and high levels of dopamine can also contribute to Huntington's disease, which is, the disease that causes hyperkinetic movements. Here's my final thoughts, all right? I wanted to give you examples of drugs that are more commonly used. I want to go ahead and insert an article here for you. This woman basically was on Ozempic, and she, I believe she was suing the company that makes it because she was, one of the side effects, of course, she was vomiting so much that she ended up losing teeth, right? Because some of you may know, some of you don't, but when you throw up, right, and you do it a lot, the stomach acid that comes up rots your enamel, okay? So this woman was losing teeth as a result of her doing it so much, being on Ozempic, all right? There's another video here that I'll play for you. It was a guy, he was on a podcast, and he talked about, he was a heavier guy too, he was big.
The OZ, it's working. Yeah. Any side effects?
Yeah.
What is it?
The main one is the burps.
Genuinely the worst thing I've ever smelled in my life.
So
I'm not even joking, dude.
We were on the plane yesterday, or the other day. We sat together, and I had it really bad. And it's literally like you're burping up rotten egg.
So then we're sitting there, dude, and it smells like we're like in the air.
I'm cranking these things out like every couple of minutes.
But you're doing like those kind of like.
I'm doing this. I'm doing the fat girl at a bar. Doing that thing, blowing to the side. You know what I'm talking about? Man.
Yeah. Dude, and I thought there was a sewage problem on the plane.
That couldn't really have been comfortable, It can't be easy. I just wanted to share those because those are some of the side effects that can come from taking these medications, right? When it comes to weight loss therapy in general, it does work, okay? About 5 to 10% of initial weight loss is experienced during, drug therapy. While many weight loss drugs have a low potential for abuse, it's not enough for you to just take a drug and then you lose the weight and then, you're not exercising and you're not eating right. You still have to make lifestyle changes, okay? It's not a simple fix. It's not a one-size-fits-all. I wanted to also write, as an example, I wanted to show you some numbers as to why weight loss therapy, drug therapy alone doesn't really do what it is you might be expecting. Okay, so looking back at that table, right, that tells you what percentage of weight loss is expected. I wrote down orlistat and lorcaserin, which I talked about in that table earlier. About 3% of initial weight loss is expected, right? That's what's actually experienced as well as expected. Phentermine/topiramate, about 9% of initial weight loss is experienced. Drug therapy alone, I put an inequality sign here. What that means is drug therapy alone, will not get you 15% of your initial weight, right? Or equal to 14 pounds, which is why the one thing that's important, if you're gonna take weight loss drugs, you really need to have a realistic goal. So if your goal is to lose, say, 14, 15 pounds, 20 pounds on weight loss drugs alone, it's most likely not gonna happen the way that you think it will, all right? You still do need to supplement the weight loss drugs with, nutrition, okay, so diet and physical activity too. It's not gonna come without a struggle. It's important, that if weight loss is your goal, it's important to be patient, right? But to also just make sure you stay consistent, all right? I mean, I don't even really say, and even personal trainers will say motivation is garbage, right? Like the concept of motivation, being motivated to do whatever, I mean, that's essentially garbage, you know? And the reason they say that is because, you know, you're essentially relying on something, or maybe even sometimes someone, to motivate you to do what it is that you know you need to do. For example, right? Me looking the way I am is motivation enough. I don't like it, I'm gonna change it. And that's what happened with me, you know, just to get a little bit more personal with you. That's what happened to me when I was in high school. When I was coming out of middle school, going into high school, I was a chunky kid, you know, I was chubby. And I looked in the mirror one day, my freshman year of high school, and I didn't really like the way I looked. So once my sophomore year came, I started getting into weightlifting, right? I started learning, you know, a little bit about nutrition. I didn't know as much as I know now, but, you know, I started eating, you know, a little better, right? I was staying away from like the fried foods and things like that, because I was one of those people that was like, well, you know, it's fried food, it's still, you know, it's fried chicken or fried fish or whatever. It still has protein. Yeah, it still has protein, but it's fried, right? It's the way it was prepared. That's what's unhealthy for you, especially if you eat it, you know, extensively. If you eat it, you know, for an extended period of time. So that's why it's bad for you. But, you know, I didn't like the way I looked either, so I did something about it. You know, you trust the process. That's what's important. You always got to trust the process. All right? The moment you give up, that's a wrap. You know, you don't ever want to give up on yourself, because it can be done. That I can promise you. All right? It's going to take work. It's going to be hard, right? It's never going to be easy. Nothing worthwhile ever is easy. But you got to stay consistent. That's going to be it for this video. Hopefully I brought y'all some good insight about weight loss drugs. You know, thank y'all for tuning in. You know, I really appreciate it. You know, like, comment, subscribe, share, you know, hit that notification bell so you know when I release a video. And y'all take care. Have a great rest of y'all day.